Hello. Today we're going to be talking about alcoholism and alcoholism treatment as it relates to the mental health nursing setting. One of the most important things that you need to know about alcoholism as it relates to the NCLEX nursing school exams and to your nursing practice are some of the treatment modalities that are available to a patient who wants to get clean. In other words, they want to end their physical dependence on alcohol. One of the very first and most important things for an alcoholic to do, or for any other person who's addicted to any type of substance to do, whether it be food or narcotics or alcohol, is to first admit that they have what? A problem. And we all have problems, but in a 12-step program, is generally one of the more popular or common usually outpatient, treatment modalities for patients who want to end their dependence on alcohol. It's really important for them to first admit that they have a problem. Why is that important? Well, it's important for them to admit that they have a problem in order for them to progress on to other steps of treatment. Because if you don't admit you have a problem, you can't what? You can't fix it, because problems need to be fixed. And alcoholism is certainly a problem. The other big thing that you want to remember when dealing with a patient who is an alcoholic is that alcoholism, just like drug abuse, and a lot of nurses have issues with this, you cannot cure an alcoholic, or you cannot cure a drug abuser overnight. It just isn't going to happen. In fact, there's some schools of thought that say that an alcoholic or a drug abuser can never be cured, so to speak. And matter of fact, they're always going to be dependent on that drug if they ever fall off the wagon, so to speak. But what you have to maintain is in the near term, in the first months, maybe the first year or two after a patient has gone through alcohol withdrawal and they're trying to get clean, you want to make sure that they understand, and that you as a nurse understand, that they're going to need regular and consistent treatment. Now, why is that? Well, we've talked about consistency in other videos, but patients who are going through alcohol, or for that matter, drug withdrawal, need structure, and they need consistency, and they need treatment. It's hard enough being an alcoholic or a drug abuser. What's even harder is coming off alcoholism, trying to wean yourself off alcohol, whether it's slowly or by cold turkey or from drugs. But it's even harder than that to do it by yourself. So people who are coming off, who are trying to cure themselves or alleviate themselves of the need to be dependent on alcohol, need a support system. They need therapy. They need treatment, whether that's outpatient or whether that's inpatient, whether that is drugs to help them ease their nerves as they come off of the therapy. Whatever it is, you need to stress first that they have to admit that they have a problem. And then once they're going through their alcohol treatment or drug treatment program, you need to stress the importance of consistency and the need for further ongoing treatment. Because being a recovering alcoholic or becoming a recovering drug addict, or what have you, whatever addiction that the person or the patient is afflicted with, is a lifelong process. They're going to need counseling, they're going to need treatment, they're going to need support. So make sure that you